tips and techniques for dealing with scoliosis in dance. Unfortunately, scoliosis affects all ages, but it's most commonly diagnosed in children, normally in their adolescent growth spurts. We know there's different types of scoliosis, but the most prevalent type of scoliosis is something we call adolescent idiopathic scoliosis, which is diagnosed between 10 and 18 years of age. Now, we also know that adolescent idiopathic scoliosis is more common in females versus males. It's actually a 4-to-1 ratio. And we know scoliosis is also a progressive condition. It's its very nature to worsen over time, and this is particularly true during growth spurts. As the scoliosis progresses, the size of the unnatural spinal curvature increases, and as these curves increases, so do the uneven forces to their body, to the person's body, and the effects that it will have on that person. We know scoliosis can also range widely in severity from mild to moderate to severe, and something like this also classified as very severe, but this is as a result of it being progressive, that as the curve gets bigger, it's more likely to get bigger. Like I mentioned, growth is the number one trigger that causes progression, which is why childhood scoliosis should be taken very seriously. Now, we also know that each case is very unique, and we don't know exactly how every scoliosis is going to affect each and every child, but the most common effect is what we see. It's a postural deviation. It's normally uneven hips, uneven shoulders, uneven waist, uneven rib cage. And as the scoliosis induces a lot of uneven forces to the spine and the surrounding muscles, nerves, and the entire body, these uneven forces can disrupt the overall body symmetry, causing the hips to be unaligned, shoulders to be unaligned. It can also create some awkward movements in the body as a result of all these postural changes. And as we know, as the health of the spine begins to deteriorate as the curve gets bigger, it can sometimes lead to restrictions in activity. And it can also affect what patients can perform. And this also may affect dance. Now, when we look at children with dancing with scoliosis, I can tell you personally that my most common patient that's an adolescent is normally a female between 10 and 14 years old. And they're either an active dancer. If they do some type of activity, they're either active volleyball player or an active gymnast. And now those are the three most common sports that I see patients coming into my office. And like I mentioned, it's most commonly a female. Now, we do not know it's because of these sports. Do they affect the spine in such a way that could potentially contribute towards progression or development of scoliosis? Or is it just because females tend to do these sports more often than males? But when we look at restrictions, we know every restriction that we provide to an adolescent needs to be taken very seriously, because restricting children is a big deal. And it's also very case specific, meaning while dance can be deemed very safe for some patients with scoliosis, for some other patients with some different types of problems, it may be approached with more caution. And the only person that can really make a decision regarding whether dance is good for you or your child and they have scoliosis is going to be the provider who actually is taking care of them based upon their individual condition, curve type, location, severity, and risk of progression. Now, we know dance is an important factor because it promotes health and well-being, and we want children to be active. And when we look at dance as interfering with scoliosis, we really decide whether we're looking at recreational dance or competitive dance. Now, when I say an average patient is in this age group, I'm talking about competitive dancers. These are patients that dance, 2-3 hours a day, 5-6 times a week. And sometimes I can see patients sometimes do 5 days a week of 5-6 hours. I can have some patients come out and they dance for 30 to 40 hours a week. So in general, the more severe the scoliosis is, the more rotation that tends to be, the more likely it's going to worsen. And therefore, these long hours of dance could interfere with effective treatment. And it's the time that you're performing the activity, which is what I believe is the biggest issue. Now, there are some movements that we are concerned about, which I'll talk about in a minute. But the big thing is the time they're performing this activity going to interfere with their treatment? And if it interferes with their treatment, now the activity becomes a risk for curve progression. Now, we know scoliosis is asymmetrical, and it causes disruption to the body's symmetry, like I mentioned, which can shift gravity. And when you shift gravity, it can cause disruptions to balance, coordination, and gait. And sometimes patients that can have a difficult performing at the same level as their curve worsens. So as curves get larger, they can start affecting the patient's ability to perform at the same level. Now, we know most patients with scoliosis, especially adolescent patients with scoliosis, don't experience a lot of pain when they're in an adolescent stage. So they normally can perform the dance. It's just meaning they can't perform as well. And they may notice asymmetry in movement, meaning they can move better in one direction versus the other. And they normally compensate for these things by only doing certain moves or certain types of dance procedures or movements in certain directions. It's this asymmetry that can become a very problem. Now, sometimes patients can see, like, well, if I'm doing dance symmetrically, won't that help me? Or if I'm doing dance like ballet that involves a lot of core strengthening and ab strengthening, won't that help me? There is no evidence that a strong body or strong muscles is going to stop curve progression. Unfortunately, we only know that there are certain moves in dance that can lead to some types of progression because we're seeing common things that can occur. And the biggest thing that we're most concerned about is when we look at arching. Things like ballet, gymnastics, volleyball, they have a lot of arching movements in the activity. And this causes the mid-back to become very flat. And as patients have a more flat mid-back, the flatter their mid-back becomes, the more likely their curve will progress, especially in a thoracic scoliosis. So therefore, when we look at patients with thoracic curvatures and they already have a very, very flat back, arching more could be something maybe we don't recommend, and we may limit how much of arching they may perform, where other patients may not have that problem and they may have more of a lumbar curve. They don't have this flat back already, and therefore the arching may not be such a big deal. So therefore, each decision must be made individually based upon that patient. Now, like I mentioned, there is some good things about dance, and that is one thing that we want to talk about as well. Like I mentioned, every answer regarding restrictions or activities need to be done by your treatment provider. But, there was a time that in place of scoliosis exercises, providers just recommend, be active, like swim and dance, keep a strong core, try to keep your body strong. And that was the treatment done for scoliosis. And even though we know that this is, can be true, like, some patients won't progress, but I don't think it has anything to do with them dancing or them being strong or being fit. I just think that no two curves progress the same. And some patients with scoliosis may not progress even though they're dancing, and other patients with scoliosis may progress and even though they're dancing, and the dance may be irrelevant because there's no way of isolating dance as the only variable since no two curves progress the same. But I do like patients to be active, especially in treatment, because we know activity or strength or well-being allows patients to respond better to care. And the healthier somebody is, the more aware they are of their body, the better response they typically get. So we normally recommend patients to be as active as possible within a time restraint or restriction based upon their curve presentation and how we're going to treat them. Now, typically more common in mild cases that where recreational dance can also cause some just basic strengthening, which you think is important, but it also affects their mood and their overall well-being. So we definitely recommend regular exercise, especially in mild cases. As curves become more severe, this is where we become more concerned about this competitive style of dancing and the amount of time, and especially with the arching of the spine. Now, last thing I'd like to mention is that scoliosis patients also tend to be something we call hyperflexible. There is a lot of neuromuscular conditions that cause hyperflexibility within the spine, and we know there's a type of scoliosis called neuromuscular scoliosis. However, neuromuscular conditions are like autism. There's a huge spectrum. So some people can have a very mild neuromuscular condition, not be able to be fully diagnosed, but have hyperflexibility in their spine. And the hyperflexibility actually makes them a better dancer because they can arch better and they can move their legs better and their shoulders better. And they have this really flexible component. Well, this really flexible component is what could potentially be causing why their curve is progressing. So even though they could perform really well and do all these crazy moves with all the hyperflexibility, it doesn't necessarily mean that that's a good thing, because normally with patients with hyperflexibility, we're trying to stabilize the curve and trying to stiffen it a little bit so the curve stops worsening during the growth stage. So it's really hard to answer questions about any specific person based upon if you have scoliosis, you should or shouldn't dance. Really, you need to look at how the curve is being treated, what's the risk of progression, look at the overall health of the person, and determining whether that person should participate in dance. And if they do, should they participate in competitive dance? We know competitive dance tends to take more time, tends to require more hours, and then therefore the more severe the case can be, doing this types of activity, which potentially could cause a negative effect to the body, is more risky. And we also know hyperextension, especially in thoracic curves, can be more risky. But however, if they're engaged in a really strong conservative treatment program that's going to help reduce the curve and stabilize it, they can probably perform these activities with some restriction based upon time, as long as they're complying with the proper treatment guidelines. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.